So today we're going to be talking about hyperbaric oxygen therapy. Now, hyperbaric oxygen therapy is when you receive pure oxygen in a pressurized environment. And there's two different ways that you can take what's called a dive. One of them is that it's in an individual unit, and then the other one is like in a group setting. So one of the great things about hyperbaric oxygen therapy is that hyperbaric oxygen therapy increases the amount of oxygen your blood can carry. With repeated scheduled treatments, the temporary extra high oxygen levels encourage normal tissue oxygen levels even after therapy is completed. So some of the treatments that hyperbaric oxygen therapy can treat are severe anemia, brain abscess, bubbles of air in your blood vessels, burns, carbon monoxide poisoning, crushing injury, deafness sudden, decompression sickness, gangrene, infection of skin or bone that causes tissue death, non-healing wounds such as a diabetic foot ulcer, radiation injury, skin graft or skin flap at risk of tissue death, traumatic brain injury, vision loss, sudden and painless. So North Kansas City Hospital has an excellent testimony online where someone named Chris had sudden hearing loss, and through hyperbaric oxygen therapy, he was able to regain his hearing back to what he described as 95%. I'm going to be including the link to that below, and I thought it was also good information. There was a comment. One person was asking, due to age, can you regain your hearing through hyperbaric oxygen therapy? And the hospital was like, for this particular case, it was a time-sensitive issue. So that is something to know, is that sometimes this is a time-sensitive issue when you're looking at hyperbaric oxygen therapy to potentially reverse certain conditions. So I didn't see stroke mentioned through Mayo Clinic, so I'm actually going to be including a link to a video below of a girl who suffered a stroke and did see some improvement through doing hyperbaric oxygen therapy. So below, I'm also going to be including a link to Joe Rogan's podcast with timestamps. He had a guest on that did an excellent job of talking about hyperbaric oxygen therapy and kind of the different things it can treat.
Hyperbaric chamber, let's talk about that for a minute. She said, I had a woman who had radiation therapy, so she had an open wound from her breast cancer, and it wouldn't close for over 2 years. Sent her down to Emory finally, put her in a hyperbaric chamber. 3 months later, 100% healed. Same things happens with people with diabetes. He says, I'm thinking he looks the max 45, maybe 40. He goes, I'm 57. I go, you're 57. He said, I've been living in a hyperbaric chamber for the last 14 years. He said, I was diagnosed with MS 22 years ago.
He's using that to keep the MS in check?
So below, I'm going to also be including a study that talks about how hyperbaric oxygen therapy increased telomere length and also the clearance of sentient cells. This is just an interesting study about how there's potential for reversing aging through hyperbaric oxygen therapy. So some of the risks for hyperbaric oxygen therapy are middle ear injuries, including leaking fluid and eardrum rupture due to changes in air pressure, temporary nearsightedness caused by temporary eye lens changes, lung collapse caused by air pressure changes, seizures as a result of too much oxygen in your central nervous system, lowered blood sugar in people who have diabetes treated with insulin, in certain circumstances fire due to the oxygen-rich environment of the treatment chamber. So how you prepare? You'll be provided with a hospital-proof gown or scrubs to wear in place of regular clothing during the procedure. For your safety, items such as lighters or battery-powered devices that generate heat are not allowed in the hyperbaric chamber. In addition, you may need to remove hair and skin products that are petroleum-based, as they are a potential fire hazard. Your healthcare team will provide instruction on preparing you to undergo hyperbaric oxygen therapy. So as Mayo Clinic states, it can be 3 to 40 or more treatments depending on what your health condition is. So depending on what your condition is will depend on whether or not hyperbaric oxygen therapy will be covered by your insurance. So I would recommend talking with your doctor or insurance to see whether or not you are a candidate for hyperbaric oxygen therapy. I know for me personally, I talked to my doctor about it and he didn't know what it was, and so he didn't recommend me. But I did talk to my insurance about it, so I am looking into whether or not I am a candidate for this. But I'm thinking that this will probably be a harder therapy to get insurance approved for. It is also expensive as well. So as for cost, I've seen mentioned $75 to $250 and sometimes more, depending on the place you're getting treatment. And I imagine too that depending on what type of treatment you're receiving, whether or not it's an individual unit or whether or not you're in a group, that might differ as well. So again, I would recommend talking with your practitioner to see what cost is and also if you're eligible when it comes to insurance. So I just want to say thank you for watching, and I look forward to seeing you in the next episode. All right, bye.